Vaccine market. Now again, there is some problem. Yeah. The impact of cold chain logistics. I would be the moderator for this panel discussion, where we have stalwarts, Mr. Harish Iyer, who is the CEO of Shanta Biotech. We have Mr. Mahesh Kulkarni, who is the Senior Vice President Technical from Biological E. We have Dr. S.M. Dodwadkar from Serum Institute, and I'm sure that that's a good number to do full justice to this entire spectrum of cold chain logistics. To set the ball rolling, I request Mr. Harish to please grace the podium and give the opening talk. And meanwhile, we could have other panelists occupying the chair here, so that as soon as he is through with it, we could start off. Thank you, please.
This discussion. I want to start off by saying I'm fairly new to the vaccine industry. I've been in the industry for about 6 months. In the past, I've worked primarily with biologics, but I think some of the technical concepts that underlie supply chain are very common. And essentially, vaccines are a mixture of proteins, polysaccharides, lipids, and so on and so forth. And very often, certainly the older vaccines, people didn't really understand the activity all that well. And even today, when I talk to people, they say many of the potency methods are based on animal-based methods, and the readouts are often highly variable, and so on and so forth. So when you have a system like this, first of all, it's difficult to manufacture, as a lot of you know already. But it's equally important that once you make a product, you keep it as tightly controlled as possible till you get to the subject at the end of the day. And it's often not a patient, but just a subject. It could be an infant in many cases. So it's critical that we try and keep the vaccine in a very controlled environment till it gets to the end point. And vaccines, in many of the scenarios all of us are dealing with, are going into the developing world where infrastructure is weak, and we know that. So it's important that, it's also important to know that you can't, let's say 2 to 8 is what the typical temperatures people store vaccines at. You don't want to go below 2 or above 8. And I think, we need to ensure that it gets to that point. I think that's obviously, so the criticality of the cold chain is there from that point of view. How do you ensure that, somebody didn't take it out of the cold room and cold box or cold chain and put it back into the cold chain? Of course, now there are wonderful improvements in technology. You started off with things like temperature monitors, but now you have things like VVM, vaccine vial monitors, that tell you, did it ever go out in a cumulative sense of the appropriate temperature range. So I think these are, critical things. Do we have, and I think the questions to be asked are do we have the appropriate cold chain in the world for the vaccines we want to deliver? And if you look at India, we have a limited number of vaccines on the UIP, a very small number. We are looking to see if that can expand, to additional vaccines. There could be pneumococcal, it could be rotavirus, it could be, in the future, HPV. It could be a lot of different vaccines. How can we expand? Do we need to expand this cold chain? That's a key thing in my mind that we have to understand. But I worked in R&D in my a year ago. For about 10 years, I was in R&D. So I'm also looking at, can we have innovative solutions to it? And and there are simple innovative solutions that we can think of, right? One is, everybody is going towards combination vaccines. So you just transport 1 vial instead of 5 vials, let's say. Another technological fix could be co-administer vaccines. Would they work while co-administering with a given vaccine? That simplifies compliance, reduces the time something is out of the box, or at least harmonizes and makes it easier for healthcare providers. And third one, maybe a longer term fix could we look at vaccines that are more stable. Okay, why is stability such a big issue? Because vaccines are poorly defined. Very often, they could be whole cell vaccines or complex combinations which are harder to understand. But could we go towards well-defined vaccines? I think from my point of view, that's something, from an innovation point of view, that's something to look at for the future. And I know even at Shanta, we're looking at different options for this, but I'm sure every firm out there is thinking about this. given the limitations in cold chain. So I think with that, I will leave it up to Mr. Das to moderate the session.
What will be appropriate to put the next question to Dr. Dodwadkar? The Serum Institute has been exporting a lot of vaccines, and probably it will be interesting to get some insights into the international marketing part.
Good afternoon, everybody. As far as Serum Institute is concerned, we started with export of vaccines approximately 20 years ago, when of course the infrastructure available in India was very limited, especially out of Bombay, reaching the vaccines from Pune to Bombay to catch international flights. Of course, today we make more than 2,000 shipments per year internationally, and we pride ourselves as an Indian company which can deliver vaccines to any corner of the earth within 72 hours. Having said this, you see, when we started off, one of the key areas where Big Pharma always challenged us, or rather challenged our capability of an Indian company to carry vaccines to different parts of the world in proper cold chain, and to the extent that they did not hesitate to visit various ministries of health in different countries, stating that it is beyond the reach of an Indian company to carry vaccines to, let's say, remote countries located in the Caribbean. But since then, we took up this challenge right from the beginning, not giving the low importance that many companies at times give to proper packaging and cold chain management, by focusing this as one of the areas that we need to concentrate and really rise up to the challenge to deliver vaccines in proper cold chain to distant destinations. And this became one of the cornerstones of our performance over the years, whereby we got very good marks from all UN agencies for having achieved this stupendous task 20 years ago with limited infrastructure. We were, of course, we were exporting traditional vaccines, and it was not the question of only having vaccines being delivered between +2 to +8, but also to certain countries which had sub-zero temperatures to ensure that the vaccines do not freeze, especially liquid vaccines. So that was the other part of the story. Normally people think that maintaining cold chain is trying to ensure that you deliver vaccines in a temperate zone, or I mean in a zone where you have high temperatures. But equally challenging is to deliver vaccines in sub-zero temperatures, which remain between the zone of 2 to 8 degrees centigrade. And this is how we started off, and today we have managed to have virtually, I would say, a 99.99% success rate of all the vaccines that we have delivered. Whatever little mishaps that would have taken place have been due to, let's say, inadequate handling by the airlines or by some local handlers. But otherwise, we have had a fairly good record of having delivered vaccines in the most appropriate conditions. The size of the packages that we have deployed are also such which are easily transportable or can be carried easily and fit within the norms of the Handlers Association at different airports, who can never complain that our packages are heavier than what their association has permitted. These are a few things on which we paid attention right since beginning and designed our packages in such a way that not only they maintain cold chain, but they're also easy to handle and fit into different cold storages worldwide.
In terms of cold chain logistics, if we were to vertically split it, probably one would be the public market and one would be the private market with all its attached challenges. Mahesh, would you like to tell us something about these challenges in two different perspectives?
Yeah, I think I represent a company called Biological E, and we supply close to 150 to 200 million doses to the Government of India immunization program. If you want to start the discussion just with the simple statement, I would say that when we talk about the importance of the cold chain, one of the very senior